Hi guys, hope all is well. Um, this is just a short video, just to tell you exactly what's been going on. So since I've started dentistry, I've had to read a lot on the computer, as well as I've had to do a lot of close work. So when I was in orthopedics before, or even in surgery before, a lot of the times I was not the first person doing the procedure. So for instance, I was assisting. I noticed when back then, which is probably like a year and some ago, that I would have some difficulty. Like for instance, when I'm closing the wound, I would have difficulty seeing. But I mean, it wasn't to the point that I would say, for instance, that I had any problems with my eyes per se. And I did wear glasses before, but they broke, and since then I haven't really fixed them. And when I got that prescription before for those glasses that I wore before, I was told that I just have difficulties doing a lot of the close work. So since I've started dentistry, you do a lot of near work. For instance, you're looking into the patient's mouth. You're probably less than a foot, probably about a foot away from the patient's mouth. And I've noticed that since I've started dentistry, I've actually had difficulty seeing. So, for instance, when we're doing the dental simulator, um, I would start in the correct position, and then as time would go on, I'd notice, why is my neck hurting me? And then I'd be like, oh, well, I've actually started to hunch. It's a hunch right over, looking directly into this patient's mouth. So I've actually realized that something is probably going awry with my eyes. So I went today and I went to get my eyes checked, and I realized I was diagnosed and told that I have an astigmatism in both eyes, with the left being worse than the right. Now, the interesting thing about that is that one of my colleagues was actually telling me that they had astigmatism, but um, they were telling me that they got the eyes checked and everything. But at that point in time, I was just telling him that my eyes were farsighted. That I was farsighted. Sorry, but what's interesting now is that no, I have astigmatism. So the optometrist was very cool, was saying, that's why you're having difficulty with the near work, because I would notice that my eyes would just get tired. I would actually, like, if I'm reading, I'd miss words. And what else would happen? For the most part, I noticed that I'd hunch. So that I literally hunch over whatever I'm doing. I have a hunch in my back just holding over whatever I'm doing. Reading on the computer, I just noticed I get very close, or my eyes close to the screen, or my eyes would just get tired very, very, very fast. So I would end up reading maybe 15 minutes, get up, go and get something to eat, probably just look around and stretch my eyes, hope that maybe I would attribute it to being tired, but it really wasn't that. It was literally something was going on with my eyes. So went into the office today. Very nice office, located downtown in Kingston. Um, Gentleman was very polite. He just they all the stuff that they do. They check the pressures in your eyes. Must mention too, I was actually kind of worried that it might have been glaucoma too, because that runs in my family. So I must admit I was a bit unnerved. Might have been, I was saying, oh no, it's going to be glaucoma or whatever, but thankfully it's not that. So I got fitted for glasses. I have to collect them in a couple weeks. Hopefully I get some relief with the near work. And now I'm actually have to save to get some dental loupes. So that's another thing I have to make sure, because I was hearing a lot of mixed stories about dental loupes. Well, for one, persons were saying that with dental loupes, after a while it affects your eyes and you're not able to see as well as you used to before. But my thing is this: with dental loupes, um, if you're looking into a patient's mouth and you can get a slight advantage into seeing some more detail, and I've seen dental loupes, not dental loupes, but I've seen loupes used before, specifically in cardiothoracic surgery when they're doing like vascular surgery, because I mean, it's a lot of fine microscopic or microvascular work. But I never thought that I needed it because I wanted to do orthopedics. So with orthopedics, I mean, they'd use it with spine surgeries and a lot of the flaps that they would do, a lot of the microvascular work. But the level that I was at, I didn't think I needed it. But with dentistry is microsurgery, and I've gained so much respect because there's a lot of microvascular work. I mean, I haven't started it yet, but I'm realizing that just based on simple things such as cavity preps, You have the tools, the size tools you use, the size drills that you use, the little work, and even little things such as touching the tooth that's mesial or distal to it if you're doing your cavity prep. You have to be able to see that, and with the naked eye, sometimes unless your eyesight is really good, you might not be able to do it. So I'm hoping that once I get these glasses, that I will get some relief, hopefully. If I don't, I'll definitely have to invest in some loupes, and just use the glasses for everyday reading. Because even now, talking on this screen now, I just came from watching my screen for about maybe 20-30 minutes, and my eyes feel a bit tired. In fact, this eye specifically, I would notice that, like, if I'm talking, I can actually feel it turning inwards a bit. It's almost like I had a latent squint, but yeah, that's another story. So, moral of the story: if you notice your eyes are getting tired, if you notice you're having difficulty with near work or work that's near to the face, if you're noticing that you're hunching over, your neck's getting sore, because even like during this term, I've noticed that my neck has actually been giving me a little bit of trouble with some pain. I thought it was how I was sleeping, and I don't even think it was that. So now I'm realizing the hunching over is what's really, not realizing, but I mean it's common sense. But I mean I'm now noticing that that was what was going on. So get your eyes checked. You're gonna need it. You're a surgeon. You need it. You need to make sure your eyes are functioning at 100%. So that's a hard story and a painful story painful lesson that I had to learn. So hope you guys are well. I'm gonna try to do some more educational videos for you guys. Okay.